Hey guys, welcome to Podiatry Practice Mastery. Don here. This is the 11th out of 20 here, the takeaways from the AAPPM meeting. We're almost there. I was noticing, I think I'm kind of front-loaded on orthotics. I think it was because the first day I had to listen to about 2 hours of lectures on orthotics, but I did get some good takeaways, and I hope they're going to help. I mentioned one the other day, is that people don't outgrow like deformities, but they compensate. So that compensation is going to cause things in their knees and their hips and other areas. And we don't always do orthotics just because of the foot pain. So that's what I'm going to talk about today. So basically, many people have no pain, such as kids and adults, but they have deformity in their foot. So for example, a very bad flat foot, other type of foot condition that they're dealing with, and we would do orthotics to help with coordination, to help with balance, to help with strengthening and posture, to prevent overuse injuries, right? So the whole goal, and this is what my buddy Neil, who's I consider him kind of the king of orthotics. His usual spiel is about orthotics not being to give support to the arch. We don't call them arch supports in our office because you can buy arch supports anywhere. What we call them are orthotics, and we say that they help mostly with posture. So by realigning and helping with the posture, it can help prevent other issues. So we don't outgrow, this is another good quote, I think I talked about this the other day, we don't outgrow deformities, but we compensate for them. So if we can compensate for them with an orthotic to help with the posture, help everything kind of be in alignment, it can help prevent future problems. I would like to know how you guys explain orthotics, or if you have any good wording, those that are listening here. Please let me know. Email me, don@podiatrypracticemastery.com. These are kind of the different types of wording techniques I use with patients. I've also used something, I mentioned this recently, is about how I explain them to patients. And I preload some of the concerns that they have. I always say, when I'm talking about orthotics, I say, hey, there's usually 3 questions that patients have for me. One is, how long do they last? And I say they last about 5 to 10 years. Sometimes they need to be refurbished. How long do they take to make? I say they take about 3 weeks to make. And then how much do they cost? And I address that. Ours are $550. So I pre-address those with patients. And that makes it a lot easier for them, so they kind of know what to expect. I find one of the challenges still for me is that when I'm treating someone, I don't want to overwhelm them with so many things. My initial lesson with this was when I used to spend like 30 minutes talking about a $5 pad. So I tend not to. I just give away the $5 pad and I spend 30 minutes talking about something else now. But even so, for example, you have a patient that comes in that has issues with plantar fasciitis, and you want to talk about shockwave, you want to talk about physical therapy, you want to talk about foam rolling, you want to talk about orthotics, you want to talk about all this stuff, and you kind of overwhelm them. So I tend to simplify it. I first start with a good shoe and they try an over-the-counter insert, and then they move to a custom, even though a custom might be better for them. So I've started to, when I look at my presentation, what's best for them is a custom if they have a significant rear foot deformity, and then I'll offer that first. I'll say, hey, this is ultimately what's best, because these other ones just can't help your posture as much. Many times they'll ask me if they can try those first. They can, but in terms of correcting the posture, a custom device works much better. Anyway, those are my thoughts for today. Talk to you guys later. Okay, bye.